first time in front of us since the injury occurred this past week. Now joined by a doctor who can do better analysis than I can, Dr. Desai, a musculoskeletal radiologist.
Yes.
I got it the third time. And the founder of RestorePDX. Thanks so much for being here. Really appreciate it.
Yeah, no problem.
Let's talk about the injury to LaMarcus Aldridge, really the nature of it, the seriousness of it, and what you think about what he's doing right now.
Yeah, so he tore his radiocollateral ligament. It's one of the two ligaments in the thumb stabilizer. It's on the outside. It's a more rare injury that we see. Nick Young had it earlier this year, had a surgery. And so it's the one, we have two ligaments, ulnar collateral and radiocollateral. So the radiocollateral ligament, it's only torn about 10% of the time. With his injury, likely is a grade 3, so a complete tear of that, those fibers. And it's going to require surgery, most likely. One of the things that they're looking at is just delaying the surgery and seeing if he can play through it. It's a non-shooting hand, so that's helpful. And the long-term studies have shown there's not that much difference, the endpoints, with healing if you delay the surgery. So it's really how much pain can he play through. There's a little bit of potential decreased range in motion if you wait for the surgery, and then the biggest thing that we worry about is development of arthritis over time if it's too loose.
So it's really a matter of pain management right now for him, how much pain he can tolerate, and if they can figure out a way to fit something on there that reduces the pain, then he can go for it indefinitely.
Yeah, and so let's see how he does. You have a splint on there and just protect it. It's surprising he's coming back so quickly, which is kind of a testament to his will and dedication to his teammates. And so we'll see how he does. But, yeah, they can wait, and it's just going to be dependent on how well he can play.
All right, and Nick Batum as well. Here's a guy who's been dealing with a variety of injuries. The wrist has been the most persistent problem for him most recently. When you've got a guy who has a chronic wrist issue, how much rest would generally be required before he could actually get back out in the court and feel like something close to his regular self?
Yeah, it depends. It's a wrist sprain is somewhat of a garbage basket term. There's a lot of ligaments and soft tissue in the wrist, and it depends on which type of injury that is. And then we grade it from a grade 1 to grade 3 if it's a complete tear to a mild stretch is a grade 1. And so anywhere from a few weeks or even a week up to several weeks for a more significant tear. So they'll rest him, ice it, let that swelling come down if you re-injured that or re-sprained it, and then restart the rehab process.
What's the balancing act as a doctor when you've got a competitive professional athlete and you've got certainly best case scenario you want to have a guy take care of his body as quickly as possible, but also balancing the idea that he's got a finite end to a season and still wants to be as helpful as possible in his occupation?
Yeah, I think you just have to look at the risk-benefit ratio, right? I mean, with an injury like LaMarcus, if you look at the studies, look at the literature, and it's saying that there's not that much of a difference if we wait, then it's something that he's there for the team, and you can go ahead and do that. If it's something more significant that you worry that if they stay, that the injury could get more severe and potentially season or career threatening, then you got to sit the player and do the surgery.
Sure. Dr. Desai, thanks so much for all the information here tonight. Musculoskeletal radiologist.
Nice.
And the founder of RestorePDX. Thanks so much for joining us. Really appreciate it.
Yep.
He was our Broadway Toyota interview. Still ahead on Rip City Live, more on LaMarcus Aldridge. We'll hear from the head coach, Terry Stotts, his thoughts on the surprise reversal from L.A. himself. That and much more still ahead on RCL.